I'm Patrice Owens. I am a licensed professional counselor in the state of Virginia. I currently, my role at Western Tidewater CSB is a team lead for the first episode of Psychosis program, also known as the Life Management Program. I also provide outpatient counseling to adults virtually. So today we're going to be talking about integrating acceptance and commitment practices to challenge resistance. We will be utilizing the chat throughout the training, and probably around the halfway point, we will be taking a little break just to stretch our legs and to recenter. I am actually really excited about this training because it's ACT is a very comprehensive, integrative modality. This can honestly be probably a day-long training, but we're going to condense as much as we can within the 2 hours that we have here together this morning. All right, so we're going to be, of course, doing an introduction of ACT. That is the acronym ACT. I went into this always calling it ACT, but I learned that it is actually ACT. We're going to be looking at the ACT framework, client resistance and or barriers, the ACT therapeutic relationship, ACT techniques and interventions, and then we will wrap it up with looking at a couple of case studies. All right, so who can benefit? And of course, like I said, this is such a comprehensive modality. So everything that we go over is not going to be conclusive. It's just going to be kind of bits and pieces that we're going to put together. So we can work with clients who have anxiety disorders, addiction, obsessive compulsive disorders, depression, chronic pain, relationship issues, self-esteem issues, trauma, etc., etc. The list goes on. Something that I think is really unique about ACT is that you can really use it for not just a broad range of mental health issues, but also across the age span. There are a lot of counseling modalities that are kind of specific, maybe towards, older people, maybe more so for younger people. But ACT really can be applied for across the ages. So children, adolescents, older individuals. And as we go through, you'll see that there are actually a lot of unique qualities about this modality. This is Sam. I want you to take a look at Sam. So there's different things about him, and I want you to type in the chat some things that you observe about Sam other than his gender. Just kind of type in some things that you observe about Sam. Okay, confident posture. He likes blue, smiling. He has blue shoes, smiling. He's young. He looks happy. I have never read this fast before. Wow. Okay, dressed casually, comfortable attire, looks happy. All right, so lots of same things. Young and happy. All right, appears energetic. All right, so some of the same things. We're looking at his posture, his facial expressions, looking at what he has on. So something that I did not see in the chat is that nobody said he is blue shoes. No one said he is blue shirt, color coordinated. Yeah, he has good style. Nobody said he is good posture, right? And so as we go through this training, we're going to see how this is so we're going to see that we are not applying his characteristics. We're not calling him his characteristics. And so this is going to be important as we move throughout this training. So kind of keep that in the back of your head as we move forward. Right. And so when we see our clients, they don't walk in and we don't say, oh, Tammy is, green shirt today, things of that nature. So keep that in the back of your mind as we move forward. Okay. All right. So a boy wearing blue shirt, a boy wearing blue shoes, a boy with brown hair, a boy wearing socks, a boy wearing shorts, a lot of the things that you all mentioned. All right. So what is the point of ACT? As we go into it, whenever we're using a new modality or just any modality, we want to know why we're using it, what's behind it, how is it going to be helpful. So ACT recognizes that people latch onto a non-beneficial thought or idea about themselves or a situation so much so that it becomes intertwined with their internal process and is assigned as a part of their identity. So, something important that I want to direct your attention to with this is the non beneficial thoughts. So, we all have thoughts, beliefs, they're never good or bad, they just are, right? So, that's why I use the terminology non beneficial. We have non beneficial thoughts, we have beneficial thoughts. Is this thought benefiting our well being? Is this thought going to help us move forward in life? Is this thought going to keep us stuck in a place that's not benefiting us? Okay. So that's going to be really, really important as we move forward in using ACT. So, what's wrong with that? What's wrong with latching onto a non beneficial thought? What's wrong with having that non beneficial fact intertwined with our identity? So, getting hooked onto a non beneficial idea, belief, thoughts, or thought can lead to problems and challenges in one's life, social relationships, and overall well functioning. And this is when we really start to look at when we're with our client and we identify, this person is really stuck. This person is having trouble with moving forward in their life. And I think that we all, I'm sure, have had or currently have clients who are stuck, who are facing barriers. And we may be working with them for months and months, maybe even sometimes a couple of years. And we're just kind of like, all right, what's going on? Why can't this person move forward? Why is this person holding on to this idea or this belief so strongly? And that's where ACT comes into play. ACT guides individuals in identifying those beliefs, ideas, and thoughts, and helps them to begin exploring how to move toward peace and acceptance. Okay, so now we're starting to get into some of the core values of ACT. Of course, as we know, anytime a person is given a clinical diagnosis, there has to be some way that their life is being affected socially, social relationships, maybe significant lifestyle changes. And so this is where ACT comes into play and really helps to start identifying what's going on. What is that thought? What is that belief? What is that idea that person is stuck on? Why can't we move past that? It's really, and I don't want to get too far ahead of myself, but when we're looking at a person becoming stuck, that becomes really problematic in their life. And this acronym is really helpful. Accept your reactions and be present. Of course, it's not what ACT stands for, but accept your reactions and be present. Choose value, direction, and take action. So accept your reactions. A big part of ACT is acknowledging what you're feeling and not acknowledging what you're going through, acknowledging your experiences and being present. So we know nowadays mindfulness is a very important part of our clinical practice. It's being, pushed a lot on social media. I mean, just all over the place. And it's very, very important. And ACT really integrates mindfulness and being present into this modality. All right, so we're accepting our reactions, we're present with where we are, choose valued direction. So basically what this means is that we have to be able to assist our clients with understanding and identifying what their values are. After we are helping our clients to accept their reactions, to accept their thoughts and behaviors, we're helping them then to know what their values are and to move toward those values, not away from them, because those non-beneficial thoughts, those reactions and behaviors towards them, it's moving them away from where they actually want to go. They're going in the opposite way, or they are stuck exactly where they are. So helping them to choose their value direction helps them to go in the direction that they want to go, which is direction towards healing, towards meeting a goal, or whatever it may be, and then taking action. So all of this is worthless if we don't take action, if we don't help the client to take action. And that's where a lot of the interventions that we'll look at in just a bit, that's where those come into play. So these are some of the core components of ACT. That last one is, they're all very important, but to me, that last one is super duper important. We want our goal as clinicians is to help our client to move forward. This is just a helpful acronym. If you're explaining this to somebody else, or if you kind of forget, what the meat of ACT is, this is the meat of it. These are some of the core components. So hooking on to non-beneficial beliefs, ideas, or thoughts. Okay, so we've already looked at why this can be harmful. Once again, thoughts, beliefs, they're neither good nor bad, they just are. But with ACT, of course, we are focusing on those non-beneficial beliefs. As we're working with the client, what is it about this thought or idea that is keeping you stuck? What is it about what you're experiencing damaging relationships or keeping you from meeting the goal that you want to meet? All right, so they can become a self-fulfilling prophecy. So we know what that is. That's one of the first things that we learn when we are in school to become a clinician. Self-fulfilling prophecy. This can come from ourselves. This can come from other people. It happens a lot, especially in childhood. You think about a child who maybe you're always telling them, oh, you're so pretty, you're so beautiful, you're smart, you're intelligent. That young child may grow up to believe that, and they may go in a direction in their life where they become very successful. Now, on the other hand, a child may grow up, the parent is always telling them how they don't work hard, they're lazy, their sibling is better than they are, they don't achieve a whole lot. That self-fulfilling prophecy, that child is going to grow up, more than likely, not always, but that child may grow up having that idea in mind. Oh, I'm not good enough. I'm not smart. I'm lazy. And so then they may grow up and behave in that way where they don't even have any goals. They don't try hard, because what's the point in trying hard? I've always been told that I'm not going to meet my goals or that I'm lazy. So once again, this can happen in childhood, but it can happen at any age. It can cause one to be stuck. Of course, we've kind of, looked into that already. Now, when we say stuck, we're looking at barriers. We're looking at resistance. And this resistance, a lot of times the resistance and the barriers aren't necessarily like a conscious choice. The client is not necessarily, sometimes they are, but the client is not necessarily choosing to be stuck. Sometimes the client may not even realize that they're stuck. And so that's when it's important for us as their clinician to really observe, throughout our time with our client, we are constantly assessing them. And so if we're seeing from the outside looking in, like, wait a minute, my client is not moving forward. My client keeps saying the same things. My client keeps doing the same things. Why is that? And then as their clinician, it's important for us to kind of bring that to light. We don't just tell them, hey, you're stuck, you're not making any progress. We know clinical ways to express that to them. But it is really important that we recognize, if our client knows even that that there's a barrier there to their progress or to meeting their goals. All right. It may lead to issues with their relationships. We know this is a biggie. Once again, one of the criteria for a lot of mental health diagnosis is that there has to be some type of interference, interfering with their life. And this, one of the ways it could be is relationships. So are you no longer, spending time with people? Are you starting to isolate yourself? Are you getting into arguments with people? This can be with strangers. It can be with people at work, your family members. What are those relationships starting to look like? Are they starting to deteriorate from what they used to be? Or a client may come in and they already have existing relationship challenges. So we can look at that. What is it about? What is the pattern that's happening that is causing issues within your relationships? It's kind of, it can be one of those situations where it's like, oh, people are always this and doing that. And it's like, well, who's the common denominator here? So it's important for us to consider that as well. So it can also increase the likelihood of missed opportunities. This is a really important one. So if we're looking at someone who is stuck, someone who is having issues with moving forward, a lot of times this is going to cause resistance. The client is going to be resistant to going out and trying things. Kind of goes back to that sample a minute ago with the self-fulfilling prophecy. The young boy who is told, you're never going to be able to do anything. You're lazy. You're not as good as your sibling. They're not going to go after, opportunities. They're going to kind of stay in their circle. And then it can contribute to depression, anxiety, and low self-esteem, once again, et cetera, et cetera. None of this is conclusive. So these are kind of like the main things that we would see, obviously, though. All right, so now we're going to move into the ACT framework. All right, so the ACT perspective recognizes that all individuals possess adverse thoughts about themselves and or their life experience. So this is basically saying that it's a part of human nature. If we are human, we're going to experience adverse thoughts about ourselves or our life experience. It's just a part of life. I'm assuming nobody walks around and is 100% of the time optimistic, positive, feeling great about themselves or their life experiences. Even if it's like maybe 99% of the time they may, but this is just the natural part of our life. And ACT recognizes that. ACT does not come in to say that, oh, there's some people who never feel adversely about their thoughts or their life experiences. Everybody does. It acknowledges that, and it encourages the client to accept that as just a natural part of. Furthermore, the ACT perspective maintains that an individual's response to these thoughts, beliefs, or idea is most important. I wish I could put a circle. I'm sure there's a way, but I'm not going to try. But I wish I could put a circle around that. It's not so much that a person is experiencing adverse thoughts, feelings, or beliefs. It's the relationship, the client's relationship with their emotional relationship with those thoughts, beliefs, or ideas. That is very important to understand. And sometimes in applying ACT in therapy, that sometimes can be a difficult part for the client to kind of understand, because as humans, we're so emotionally driven that's what we kind of latch onto. But we're looking at that emotional relationship and our responses to what we're feeling, to our adverse experiences. According to the ACT framework, the negative conceptualization of one's beliefs about themselves and their adverse response or behaviors to it is what causes dis-ease, not the feeling itself. I wish I could underline that one. Once again, very important. So it's not so much, according to ACT, it's not so much the feeling. And this is a little bit different from most modalities that we're used to in clinical practice. A lot of times we're focusing on the feeling or the belief itself. But with ACT, we're focusing on the response, the interpretation to the belief, to the idea, to the thought, to the experience. That's what the focus is on. What is the response? How is the client positioning themselves emotionally to the adverse belief? As we all know, the common saying, perspective is everything. And it really is. And this saying is so important. And when we're looking at ACT, the way that a person perceives something is their reality. And so as the ACT clinician, we want to help the client really acknowledge their perspective / their reality and see how it's non-beneficial and what kind of ways. So that goes back to that self-fulfilling prophecy. It goes back to the missed opportunities. It goes back to the issues within relationships. Why is that emotional attachment to your response? How is that really adversely affecting you? Once again, as a clinician, it's our job to help them to just kind of break that down, kind of just unravel that. All right, so we're probably all familiar, at least with the name, of relational frame theory. It's the underpinning structure of ACT. It is the collection and empirical evidence of the impacts and use of human knowledge and language or cognition. It is a way of defining how humans shape understanding and behavior in response to the world around them. It sets the framework for the ACT ideal that language leads to mental discomfort. And so once again, sometimes it can be a little difficult to wrap your brain around that. In ACT, this education about just kind of like cognition and really what we're doing with the client, it's pretty critical. I'm the type of person where I need to kind of understand or have an explanation of like the background, the underlying stuff before I do it, because it makes a little bit more sense to me that way. As a clinician, once we understand kind of where ACT comes from, the backbone of ACT, then we can explain that to our clients, and then we can, help them move forward. A lot of this can be cultural. Think about different cultures. They have words to explain things. A lot of times, like Native Americans and the Japanese culture, they have words to explain experiences and feelings that in the English language we really don't have. If you ever have a chance, look into that. It's really cool if you don't know about that. But, they have words that explain certain experiences that we don't have. Basically, what we acknowledge, what we have a collective, widely accepted view of things, that's what it becomes in our culture. So, for instance, this clock, right? So, this part right here, and you just type in the chat, what shape is this clock? What shape? How would you describe the shape of this clock? Round, circular, like an onion with a slice taken out. But yes, but yeah, because onions are round too. All right, sphere. Yeah, onion. Okay, so now every time I look at my clock, I'm gonna think about an onion. So absolutely. So up here is well rounded. Yeah. So we all pretty much agree that the clock is round. It's a sphere. It's circular, like an onion. And that's because we all agree on it. At some point in time, someone named round things a circle. Someone said, oh, something that rolls is round, is a sphere. Something that doesn't have corners and edges is round, and we all just kind of agree on that. So when we're looking at we're looking at the use of language. So to get to the emotion part of this, in our culture, if we say something is bad, then we all kind of know what that means. We know what that feels like. It doesn't feel good, right? If something is good, then obviously it's a feeling that we like. That's kind of, what we look to achieve in life. Relational frame theory argues that how we define things that happen to us and our response is very, very critical. And so this sets the framework for language leading to mental discomfort. And on the other hand, it sets the ideal that language also leads to mental comfort. And that's what we want to do. And as we're moving away from mental discomfort and we're moving to mental comfort, and we're looking at those responses to our emotional responses to our thoughts, ideals, and experiences to try to move towards mental comfort, because that's what we all want. We want to feel good. We want to have, beneficial experiences in life. And that's the same thing that our clients want. So we are using this to help them to move towards that. To take it a little further, if you fall and break your leg, you can type this in the chat. If you fall and break your leg, how would you feel about that? You feel good, bad, happy, miserable, unlucky, in pain, clumsy, annoyed, very upset, sad, bad, in pain, not thrilled. How much time do I get off of work? Yes. If you break your leg, do it at work so you can get workers' comp. Sad, uncomfortable, limited, inconvenience, miserable, unless it could put me out of a meeting I don't want to attend. I would be mad, confined, fearful, defeated. Absolutely. Yes, I agree. So we all kind of agree. It's not a great thing, but I did see some comments: fearful, overwhelmed, dependent. Absolutely. And so that's natural. Like, we're not going to feel great physically, mentally, or emotionally about breaking a leg or getting any kind of injury. But if we get stuck in those feelings of fear, if we get stuck in feeling those feelings of being dependent upon others, we get stuck in feeling overwhelmed, all of those things that you all said, confined. If we get stuck there, it's going to be much harder for us to be able to move towards healing our leg, right? And then on top of that, if we get stuck in those emotions, we may start to have a self-fulfilling prophecy that, oh my goodness, like I'm so clumsy, I'm terrible, I can't even walk in a straight line, like I trip over air, and then we start missing opportunities. Maybe we don't, participate in the 5K that we wanted to do. Maybe we stop hanging out with people. And this sounds kind of extreme, but like when you really think about it, this is how the progression of things happen. This is how the progression of people being stuck really happens when you really break it down. It's like, well, what happened first? Of course, we know as clinicians, we are detectives. We go back, we look at the root cause. How did we get here? And with ACT, we're looking at how did we get here? What was the sequence of events that led us here? And of course, what beliefs do you have about what happened? And what is your response? How are you interpreting these beliefs? So hopefully that's a good understanding of relational frame theory and how it relates to ACT, how it drives ACT. All right, so what is unique about ACT? A lot of things, but we're going to focus on this. So unlike most scopes of therapeutic practices, ACT does not aim to reduce client symptoms. Oh my goodness, what are we doing then? Why am I even here as a clinician, right? That goes against pretty much most therapeutic modalities. Like, I'm not trying to reduce your symptoms. Its main goal is to shift the client's relationship and perspective of uncomfortable thoughts and feelings and move toward viewing them as neutral. So once again, thoughts, emotions are neither good or bad. They just are. They are literally just a part of human existence. Perhaps that's what sets us apart from animals or from aliens. I don't know. I can only speak to being human. It's just a natural part of life, and they are neutral. They are things that are happening to us. After successful implementation and practice of ACT, symptom reduction occurs as a byproduct. So that's the cool part. We're not focusing necessarily on the symptoms. They are important. We do have to investigate them and acknowledge them and accept them, but we're looking at, once again, the client's emotional relationship or response to them, and we are going to unravel those. We're going to look at them as neutral, and as a byproduct, as a result, symptom reduction is going to occur. It's really important if we are engaging our clients in ACT, we want to make sure that we explain this to them, because a lot of times, most of the time, if I'm going to therapy and I'm feeling depressed, then my expectation in therapy is for my client to give me interventions and techniques to reduce my depression, to reduce my sadness, my feelings of hopelessness, worthlessness, excessive, all those things. Like, I'm looking for those things to be addressed and for those things to really be taken care of. But in ACT, that's not necessarily what we're doing. And so explaining that and educating the client on, hey, I'm not ignoring your emotional experience. I'm not ignoring the symptoms that you're having because of your experience. We don't want, because that can feel neglectful to a client. So we want to make sure that we explain that to them. And then, hey, after we go through everything that we're doing in ACT, you're going to notice that your symptoms have actually reduced. And that's kind of the cool thing about it. And clients will also, and that's kind of one of the premises and understandings of ACT. If we're focusing on the symptoms, then not necessarily saying that they're going to get worse, but like, how much are we really moving forward? And that can be another reason why our clients are stuck, because we're focusing so much on the symptoms. And yes, I can give you techniques until I'm blue in the face, but if we're looking at that emotional relationship, to those beliefs, ideas, and thoughts that are causing the symptoms, we're not having much traction. Really important to express that to your clients. We want to make sure that they understand that we're not being neglectful, of their symptoms. We recognize them, we acknowledge them, we know they're there. But I want to help you to understand why you're feeling so strongly about what you're feeling and your experiences. All right, so moving from being stuck to unstuck. So this is where we're going to start taking action. This is where it becomes fun. This is where it becomes productive. Not that it wasn't before, but this is where it becomes productive. All right, so psychological flexibility, what is it? The ability to recognize, acknowledge, and remain present with uncomfortable thoughts, feelings, and emotions while simultaneously making choices rooted in logic and value. So this value concept comes up again. It's the process of shifting how an individual relates to those uncomfortable thoughts, feelings, or emotions. Sitting in uncomfortable thoughts, feelings, and emotions can be scary for anybody, no matter how uncomfortable they are, because that's on the spectrum. But, recognizing that we're asking our clients to sit in and be present with what we're feeling that doesn't feel great, that's a lot. And it's important for us to acknowledge that to our client. When we're asking them to do that, when we're going through, our interventions that we'll look at in a bit, we do want to acknowledge, to our client, hey, I know that this is uncomfortable. I know it's not. And this is why we've been running away from them or, whatever we've been doing. But I'm going to support you. I'm here to support you in sitting in those feelings or those thoughts. And so helping them to shift from those uncomfortable thoughts or feelings, that's where we start to get some traction. So that's what we want to achieve. We want to achieve psychological flexibility. So what it's not is an attempt to alleviate uncomfortable thoughts, feelings, or emotions. Just like the previous slide, we're not trying to take them away. We're understanding our relationship to them. And as a byproduct, those will be decreased. I'm not going to say taken away all the way, but they will be decreased. All right, so let's look at some internal experiences. So internal experiences are what someone experiences in the mind or the body that typically precede or initiate the maladaptive or non-beneficial behavior or sequence of thoughts. And those can occur in a few different ways. They can come through bodily sensations. Maybe a person begins to feel nauseous as a trigger. Maybe a person starts to get a headache or a migraine, clammy hands, sweaty hands. Maybe their stomach starts to hurt, which is a really common one, especially in children. They may experience some urges. So those urges may be to act on a compulsion. If we look at those who have obsessive compulsive disorder, maybe a tic starts to come. Maybe there is a lot of hand washing, excessive showers, things of that nature. Or maybe there's an urge to consume a substance. Memories. We see that a lot in those who have post-traumatic stress disorder. Perhaps there's a memory that happens, and that's what triggers the maladaptive thought or behavior, and of course, thoughts. And of course, emotions. All right, so these are the things that some of the things that people can experience internally. And so these are things that often someone on the outside is not going to see as something internal. But of course, as clients, clinician, we kind of know them. We may start to see some of those things happen. If a person, maybe their spouse or someone close to them, we can kind of see oh, okay, so-and-so has a stomach ache, or so-and-so is starting to, their tics are coming out. So a lot of times they are within, but those close to us may be able to recognize when those things are happening. How is psychological flexibility achieved? Through acceptance, all right? So acceptance is the act of awareness and acknowledgement of uncomfortable feelings and the avoidance of pushing them away. So the opposite of acceptance is going to be experiential avoidance, all right? So acceptance can sometimes be a tricky thing, because if we tell a client, okay, let's work on accepting this uncomfortable feeling that you're having, they may say, but I don't I don't agree with it. But acceptance is not necessarily agreeing with it. It's more so, it's here. I'm acknowledging it. It's part of what I'm experiencing at this point in my life. And so when we are avoiding those things, in the moment, we're moving away from them in whatever way that we are consciously or subconsciously choosing to. And then cognitive diffusion. And so as we go through these, you might see a little bit of overlap in what these things are, and that's okay because it's going to look different in every client. And so just knowing your client, knowing our experience, knowing their experiences is what's most important. So cognitive diffusion is creating distance between one's thoughts and absolute truths. Diffusion brings recognition to the fact that thoughts are mental events that naturally occur. So the opposite of cognitive diffusion is going to be cognitive fusion. All right. So if you kind of think about I'm going to use pens. I'm a very visual person. This is the maladaptive emotion, thought, behavior that the person is having. This is the person. With cognitive diffusion, it's going to be further away. With cognitive fusion, that thought, that maladaptive thought becomes that person, and that's how they move throughout life. And that's where that being stuck comes into play. And then being present, practicing mindfulness to be fully aware of present feelings, thoughts, and sensations without judgment. That last part is critical, without judgment. So we're not saying, this thought that I'm having is so bad, it's terrible, how am I going to go on? We're just simply acknowledging it. It's saying, okay, I feel sad, you're here, it is what it is. So we're not naming it, we're not judging it, we're just acknowledging that it's there. So the opposite of being present is getting stuck in the past or the future. All right, so committed action. Engaging in meaningful and purposeful behaviors that are in alignment with one's values. Once again, that values comes up. And that's something that we help our client to identify what their values are. So the opposite of committed action is, of course, inaction. All right. And the meaningful and purposeful behaviors, there are interventions that can help us guide our clients into achieving those things, into working through those things. All right, values clarification, the process of connecting with core values, even in the midst of challenging thoughts or feelings, because it can be hard to even think about our values when we are experiencing something that doesn't feel great to us. So we want to help them to understand those and move through those. And the opposite of values clarification is lack of direction or value confusion. Lastly, looking at psychological flexibility, self as context. This is one of the main ones in ACT. The ability to see one's thoughts as being separate from their identity or self. And this is similar to cognitive diffusion, as you see. The opposite of that is self as content. So we want our client, we want to help our client to achieve self as context. I am not what I'm feeling. My feeling is something that is passing by, is something that is happening to me, but I am not my feeling. All right, so we have our ACT staff guide to kind of wrap up kind of the main point of ACT. So once again, ACT states that the root of mental illness is not uncomfortable thoughts or ideals. Rather, it is the interpretation, relationship, and response to those internal experiences. So that is our focus when we are working with a client and applying the ACT modality. All right, so we're going to move into client resistance, barriers. Going to take a little bit deeper look into it. And we will see in this part some familiar terms and ideals as we move through. All right, so in ACT, we refer to these, the barriers, as mental traps. So mental traps are what gets in the way of having a healthier relationship with internal thoughts and beliefs. That's what we're going to help our clients to look at. So experiential avoidance, we've heard that already. Problem solving, entanglements, and avoidance of the present. So in the next couple of minutes, we are going to just go a little bit deeper into these 4 mental traps and Once again, this is not a conclusive list. There are several mental traps that ACT identifies and acknowledges. All right, so looking at experiential avoidance. Experiential avoidance, those are efforts to avoid, escape, or suppress uncomfortable internal experiences, which can be thoughts, feelings, or beliefs. This tendency can increase psychological distress by preventing individuals from accepting their thoughts and feelings and from acting in alignment with their values. So, looking at an example, Bobby believes that they are ugly and undesirable. They believe that no one will want to date them or find them attractive. As a result, they avoid looking in mirrors, going on social outings, and attempting to date. This avoidant behavior is causing existing relationships to become strained. So, we see those challenges in relationships, leading to social isolation and potentially missed opportunities of finding a date or meaningful relationship. So, once again, the challenges in relationships come into play and missed opportunities. Kind of that self fulfilling prophecy once again. Bobby is attaching a feeling to their thoughts and this emotional response relationship to the thoughts and emotions are leading to challenges in Bobby's life. Bobby is stuck in those thoughts and needs a little assistance with understanding that relationship with their thoughts and moving forward. So with ACT, perhaps Bobby's goal can be to go on a date, right? So Bobby, once they finish going through ACT, ideally they're going to go on a date. They are going to look in mirrors every time they pass a mirror. They're going to feel good about how they look. They're going to go on social outings with friends. And then looking at problem solving. The natural tendency for someone to solve a problem when a situation, thought, or belief is perceived to be a problem. ACT views fixing an internal situation as potentially counterproductive because it could exacerbate the issue. Now, this is different. Emotions are very unique, right? They're important because they tell us what's happening around us or within us, but they're unique. So let's say, for instance, and you can type it in the chat, if your chair breaks, and I know I'm going to get a variety of responses with this, but if you're sitting in your office chair, and God forbid I'm sitting here and my chair just breaks and I fall on the ground, but if your chair breaks, what is going to be your natural tendency? Like, what are you going to kind of immediately think about? What are you going to do if your chair breaks? Laugh, curse, grab to something. Now, how many of us would fix the chair? Go find another chair, get a different one. So most of us, we would probably try to fix the chair if we're able to, or we may go buy a new one if we're able to get another one. Yeah, so absolutely. So that makes sense. If something breaks, if something needs fixing in life, then we usually fix it. That makes sense. But when it comes to our emotions, how we're feeling, problem solving says that, that's actually not the best thing to do. We don't want to try to fix our problems or what we're experiencing. We want to try to understand them and work through them. So Brad believes that he is not a valued member of his family. To solve the problem, which is he views as not being a valued member of his family, he avoids being around them. This has led to distance between himself and his family. He has missed out on several family events and he feels resentments toward them. So in order to solve Brad's perceived problem, he avoids being around them. There's distance between himself and his family, and now he resents them. So he was trying to solve the problem as opposed to understanding why he's feeling the way that he does. And then moving into entanglement. And this one, once again goes back to self-fulfilling prophecy. It's a very, very common one. When a person latches onto an ideal or belief so intensely, it can become a part of their story. They then begin to interact and move about the world under the premise of that story. This mental trap can lead to a negative or untrue identification of self. It can cause missed opportunities and a negative sense of self. For example, Barbara believes that she is stupid. She often jokes about not being able to do things or figure things out. When hanging out with friends, she will make statements such as, "You know, I can't go to trivia night. I'm so stupid. I wouldn't get any of the answers right." So Barbara is latching on to the idea that she is stupid. And as mentioned earlier, this may be something that developed in childhood, maybe growing up, just like the example earlier, perhaps, kids at school called her stupid. Perhaps her parents even called her stupid. And so she's latched on to that idea. And now it has become a part of her identity. Perhaps, and Barbara was in an abusive relationship and her spouse called her stupid all the time, put her down. And so she's become entangled with that belief or that ideal that she is stupid. And so, once again, in therapy, we're detectives. It is important in ACT. We don't want to spend too much time trying to investigate why the feeling came or why the thought came, but it is important to kind of address that, maybe doing a timeline or something of that nature. Where did this belief come from? Why are we feeling this way about it? And then avoidance of the present. When experiencing an uncomfortable thought or emotion, a person may return to old behaviors or thoughts or ruminate on what can go wrong. This diminishes one's ability to focus on their present experience, which prolongs addressing the problematic thought or belief. So this can kind of be looked at, kicking the bucket down the road. We know that this is an issue, but, we're not really addressing it. We're just kind of going along with it. So for an example, Max struggles with feeling lonely. When he experiences this feeling, he heavily engages in substance use to quiet the uncomfortable feeling. So rather than looking at moving toward valued action, Max is just like, you know what, I feel lonely. I don't feel great. So I'm going to use. And so we know the trajectory of where that can go with substance use to try to cover or quiet uncomfortable feelings, thoughts, or emotions. So we're going to take a look at the therapeutic relationship in ACT. It's critical and it's a little bit unique in comparison to our therapeutic relationships when we're using other modalities. So the therapeutic relationship in ACT focuses on collaborative efforts. All right, so we are working together, like we're kind of partners in our therapeutic relationship with our client when we're using ACT. Of course, we're not working on our own stuff in any sense, but we're on the same page as our client. We're working together. There is clinician and client equality. When we are the therapists using ACT, we do, but we don't know more than the client. We don't put off that we know more than the client. We're not necessarily the expert. We are, but we're not necessarily the expert in this relationship. There is equality between us both. It focuses on shared acceptance of ACT core values, of course, taking action, acknowledging that emotions are a natural part of life, adverse experiences are a natural part of life. We're accepting of those, we agree on those. Those are things that we are going to focus on in our relationship. Shared values and goals. And, this is similar to when we're looking at shared goals, this is similar to any therapeutic modality that we're using. We have to agree on the goals. We can't be going this way and our client is going this way towards the goal. So we want to make sure that those things are shared. And with the shared values, we want to make sure that our client is able to identify and voice what their values are. And we need to be understanding of that as the clinician. And openness for flexibility and adaptivity. That's one thing that I really appreciate about ACT, because there's so many different interventions when it comes to ACT that, I often tell my clients, if this doesn't work, then that's fine. We just try something else, no big deal. And ACT really, really pushes that. we can be flexible. We have the time and the space to be flexible with what interventions that we use. We may try something and it's like it doesn't work. It may work for one person, but not for the other. And that's completely okay. So, as your clinician, I'm not going to just, focus on this one intervention because I think it's best or I can see that it's best for you. I'm going to say, like, okay, that's cool. Like, this may make the situation worse. So, I don't want to keep using it. So that's a really important thing to make sure that we implement. And as we go into applying ACT in our therapeutic relationship, I think it's also important that we go over these components with our client so that we're both understanding our relationship, what's happening, what can I expect? What role are we both playing in this relationship? All right. And the shared acceptance of pain as a normal human occurrence. Once again, it happens. We all experience it. It's even okay for you to tell your client, hey, I experience pain too. I experience emotions also because I'm also human just like you are. All right, so this is the two mountains metaphor, which I absolutely love because it really encompasses the relationship between the client and the counselor when we're using ACT. So the two mountains metaphor is meant to conceptualize the relationship between the therapist and the client while incorporating ACT. The metaphor invites one to imagine the client and the counselor climbing two separate mountains side by side. The therapist, and which is speaks to that partnership point. The therapist and the clinician begin climbing at the same time. Both encounter challenges and obstacles along the way. Because of the therapist's angle, they are able to see upcoming obstacles along the client's path, as well as potential ways around those obstacles, which are the interventions that we use. The relationship is collaborative, non-judgmental, and open. So if you kind of visualize it, typically in a traditional therapy session, you're sitting here, your client is sitting across from you. If you can visualize the relationship, I'm not asking you to invite your client to sit next to you, but if you are visualizing that relationship, the clinician and the client are sitting beside each other on the couch. Once again, we don't have to do that if we're using ACT, but that's just kind of a way to visualize the uniqueness of the client-counselor relationship when we're using ACT. All right, so we're going to look at some techniques and interventions that we can use when we're using ACT. And, once again, this is not a full list. I think we're going to send out a resource that has a ton of techniques and interventions that you can use with your clients in session. Because once again, what works for one does not work for everybody. So we want to make sure that we explore different ones. So when we're looking at some themes in ACT interventions, they focus, of course, on mindfulness, metaphors, experiential learning, and paradoxes. We are looking at moving our client from being stuck to being unstuck. Mindfulness, being present, being non-judgmental with what we're experiencing, and accepting that we are experiencing what we're experiencing. Metaphors, once again, such as the two mountains metaphor, those are used a lot in interventions and ACT. If I had to guess, I would say that for a lot of people, metaphors just make sense. It's kind of like taking an issue that we don't really understand and applying it to something else in a way that makes a little bit more sense. And this speaks back to the relational frame theory with language and cognition and the way that we understand our understanding and perception of the use of words, the use of language. So metaphors can be a very, very effective way in helping to just kind of move a person to being unstuck. And experiential learning involves a client actively engaging in action to gain a deeper understanding of what they are experiencing. And that can kind of be compared to exposure therapy in a sense. So that also can be very helpful. Now, when it comes to experiential learning, I wouldn't necessarily introduce experiential learning as a first intervention in ACT. I might focus on mindfulness first because once again, it's important that we help our clients to understand what's happening and to be present. Experiential learning, I might save that for when I feel like, okay, the client has a good understanding of what's happening. Now, let's take this into action. Like, let's apply this to real world. Let's start moving towards those action goals. Similar to exposure therapy. We don't just bust in the session like, hey, let's go, pet a dog if we're fearful of dogs. Same thing. All right. And so then paradoxes, challenging thinking through contradictional statements, avoiding pain. Let's say, for instance, we have a client who is cutting. The client experiences a non-beneficial thought, feeling, those urges come, those internal experiences come. The client goes and they cut. In the immediate moment, they experience some relief from what they're feeling. But in the long run, it doesn't help anything. It's actually causing more harm. And so for clients who engage in these behaviors, whether it's self-harm, whether it's, substance use, isolation, whatever it is, when we're using paradoxes, it's important that we help our client to understand, first of all, what are you doing to try to avoid the feeling in the meantime? And we acknowledge, like, yeah, it gives you some relief. That's why you do it. It gives temporary relief. But in the long run, how is this causing harm? How is this keeping you stuck? How is this behavior keeping you from moving forward and reaching your goals? One intervention that I really, really like is the observing self. All right. So this is, a prompt that you can use with your client. It kind of sets the basis for ACT techniques, in my opinion. So we can just read the prompt to our client. You can invite them to close their eyes, whatever they want to do. All right. So we have three aspects within us: one that thinks, one that feels, and one that observes both thought and feeling. You may hear this part be referred to as observing self, the noticing self, the watching self, or pure awareness. I also invite you to create a name that makes most sense to you. If a client can come up with their own thing, it might resonate a little bit more. The observing self is a safe inner space that we can learn to access at any moment. This part gives the client power. It can give the client hope that if I'm feeling uncomfortable, if I'm experiencing something, a thought, a feeling, or ideal that feels uncomfortable, I have a place inside of me that I can go. Nobody else has to know about it. I love interventions or techniques that you can use anywhere in the moment and nobody has to know. A lot of times our younger clients, they're kind of like, well, I don't want to, I don't want people to know that I'm doing this. So this is one that the client can remember. They can go inside themselves. They create a safe space that they can go to whenever they need to. Nobody has to know. By connecting with our observing self, we reduce the influence our thoughts and feelings have over us. Our thoughts and our feelings happen to us. They are not us. I have control over them because they're happening to me. They're not staying forever. We don't want them to live rent-free in our head. That's not what we want. They can come in, they can visit, then they got to go. All right. So listening to this prompt, reading this prompt, all right, sense of control, power, control, reassurance, being objective. Ooh, yes, for sure, being objective. Client might not agree with those three assets of self. Very important. They may not. And then we use another intervention for them. Excellent point. And I hope that you all kind of got that too. But yeah, absolutely. The client may not agree with those parts of self. And that may be for whatever reason. It could be a cultural thing, a spiritual or religious thing, or they just may be like, that doesn't make any sense, and we have to acknowledge that. That's where that flexibility and that adaptivity comes into play. Like, okay, that's fine. I am okay with the fact that this doesn't resonate with you. Let's look at something else. We can ball that prompt up and throw it away. We don't need it. It's cool. Radical acceptance. Yep. This makes us mindful. Absolutely. Absolutely. And so, yes, I love this prompt, but if my client doesn't, I'm not going to use it. So another intervention is dropping the anchor. All right. So the dropping anchor is a mindfulness technique that invites the client to stop in the midst of experiencing an uncomfortable thought or sensation. The client can be encouraged to practice deep breathing exercises and work on accepting the uncomfortable experience in vivo, in the moment. By practicing this technique in session, the client can learn to practice it outside of session when necessary. All right, so this is another mindfulness, another one that we can do internally that nobody has to know what's happening. So you just visualize, you drop an anchor, ship stays put. So we're dropping the anchor, we're being in the moment, we're acknowledging, we're recognizing that I'm having this experience, whether it's the urge, whether it's the thought, the emotion, whatever it is, I'm experiencing this. Let me work on it. I'm going to do deep breathing. I'm going to do, maybe 5, 4, 3, 2, 1 exercise, progressive muscle relaxation, whatever it is that feels comfortable for me to be mindful of what's happening inside of me. And of course, any intervention, any technique that we are asking our clients to do, it is imperative that we do it in session with them. We want to model it, we want to role play, whatever you want to call it. We do want to do it with them in session so that they know how to do it on their own when they are not with you. All right, and the next one we're going to look at is values and clarification reflective questions. So the focus of values clarification is to guide the client in identifying and understanding their values. These questions also put the client in a more appropriate position to begin taking action because ultimately that's what we want. We want action. So for an example, your tombstone, I think we're probably mostly familiar with this one. What do you want your life to stand for? What do you want others to think of you? And what ways are your current actions, thoughts, and beliefs in alignment with that? So a few different questions there. Honestly, depending on the client, you may not get through this whole intervention in one session. Maybe the first session, not the first one, but maybe the first session in using this technique can be exploring what do you want your life to stand for. You can take that can be an entire session. You can incorporate art therapy into it, music therapy, and narrative therapy. So this doesn't have to be all in one session. It can be, but depending on the client, it may not be. All right, and the next one is tug of war. So this metaphor is used to demonstrate the pull between avoiding distressing thoughts, beliefs, or sensations and accepting their presence. So once again, sort of a mindful one. I like visuals, and so I really love how this image portrays the avoidance on this side, the acceptance on this side. And at any given time, the knot may be closer to avoidance, the knot might be closer to acceptance, right? So depending on what's happening in the person's life at that time, that day, that week, whatever it is, they may be closer to one end. And so they can visualize in their mind where the knot is. And perhaps, this can be, if the client likes this intervention, if it resonates with them, this can be something where, how sometimes you'll do a check-in with your clients, like, hey, is your head underwater? What color is your cloud today? That sort of thing. This can kind of be like starting a session. Where's the knot? Where's the knot today? Are you closer to avoidance? Are you closer to acceptance? Why? What happened? Let's explore this a little bit. And this is something that, like I said, you can use in session, or the client can take it outside of session, just kind of checking their temperature. Because oftentimes, our feelings are going to fluctuate depending on what's happening around us. So once again, you'll get a list of a lot of different interventions. This is just probably like 5.5% of the ACT interventions that exist. But there are a lot of them. And thankfully, because, this is a very unique modality. And so once again, what works for everyone, what works for one is not going to work for everyone. So this allows us that flexibility to explore a lot of different techniques. Lastly, we are going to, once again, that's probably like 10%, not even, of all of the techniques that exist. So lastly, we're going to look at a couple of case studies to kind of apply some of the things that we have discussed this morning. So the first one, we're going to meet Angie. Angie is a 29-year-old female who was employed as an IT specialist and works from home. She is recently diagnosed with obsessive compulsive disorder. Angie struggles with intrusive thoughts about contamination. Throughout the day, Angie experiences thoughts that whenever she touches anything, she will immediately fall ill. When she has this thought, it is accompanied by a rush of nausea, immediately followed by feelings of fear, panic, and helplessness. So those are those internal experiences. In an attempt to fix this problem, Angie wears latex gloves daily for most of the day, uses a significant amount of potentially harmful disinfecting products, and takes anywhere from 3 to 5 showers per day. Furthermore, she avoids going in public unless necessary. We really want to help Angie, and we think that ACT will be a really good way to help Angie to become unstuck. So in the chat, I kind of want this to just be kind of free, kind of open. What are some things that you observe about Angie? What are some mental traps she's having? What are some ways that she is maladaptively coping with what she's experiencing? Her attempts to solve the problem are really avoiding it. Yep. So there's some problem solving she's having, mental trap of being contaminated. When did she first start being worried about contamination? That would be a really important question to ask. I don't have an answer. Let's just say during COVID, that sounds appropriate. Everything out in public is harmful. Yes. Managing cognitive disorders, agoraphobia. So all these are great. What can she take control of in her life? Ooh, yes. And so we might look at decreasing the amount of showers that she's taking, you know, but definitely helping her to acknowledge what she's experiencing and start to point out how her relationship to those fears is actually really hindering her and driving her to engage in potentially harmful behavior. So some of her mental traps, you all said it: problem solving, experiential avoidance, and inaction. Boom, you guys said it. All right, so but some potentially helpful interventions might be dropping the anchor, the struggle switch, which is sort of like tug of war, and mindful breathing. Once again, there's a million that we could help her, that we could apply, but those might be a few that we can start with. All right, and then our last case study, we're going to meet Ken. All right, so Ken is a 40-year-old city bus driver. He was diagnosed with major depression disorder around the age of 25. Upon switching therapists last year and adopting the ACT framework, Ken was able to identify a pattern of negative thoughts he has been experiencing since he was a teenager. So he's already made a little progress using ACT. Ken describes feeling left out from the rest of his family. He tells others that he is the black sheep and that his family does not care about his interests or even see him as part of the family. He states that he desires to be accepted by his family and included. However, he tends to avoid family functions altogether. Out of fear of feeling rejected by others, Ken avoids dating. All right, so hit me with some thoughts about Ken. What might be some mental traps he's experiencing? How might we begin to help him through the ACT model? Okay, associates relationships with shame, hence the dating hang up. Absolutely. Avoidance, problem solving. He identifies strongly with the idea of being the black sheep. He does. Avoidance of the present. Avoidance. So we can definitely see where he's stuck, that thought of the black sheep. Ivan Ken, avoidance and isolation are not helpful. Absolutely. Solves the problem in the moment, but not long term. All right. So some mental traps. Once again, y'all said it: entanglement, avoidance of the present, and problem solving. So some potentially helpful interventions that we can use: the clean and dirty discomfort diary. We're writing it all out. Cognitive diffusion. That speaks to that black sheep. Yes, you have identified yourself with the emotions, with the response to the emotion that you're feeling. So that's all I have. I'm going to open the chat up to any questions that we may have, any further points of discussion if needed. Replace the lie he believes with the mantra made of truth. Yes, absolutely. Yes, yes, yes. I like that. Become a part of a group or nonprofit volunteer to give him some confidence. I love, yeah. So someone put in the chat, helpful with autistic patients and those with executive functioning problems, focusing on flexibility of the thought. Yes, that's very, very good point. Absolutely. Because it gives you that flexibility, which gives the client control. Would anything change with how this is used with substance use clients? I would No, I think it's more of the interventions that you're going to use. Because when we look at clients with substance use issues, it's about that control a lot of times. And so looking at the relationship between the client believing that the substance use is helping the problem, that's sort of looking at like that the tug of war, how much are you avoiding what's really happening versus moving towards accepting what's happening. So, and I think once again, with the flexibility and the amount of techniques that can be applied, you can kind of pick and choose what works the best. So I don't think anything would change when you're working with substance use clients. And that's kind of the uniqueness with this modality too. um, it can be used for such a broad population of clients, and you could still kind of follow the same model. But that's a really good question.